Hi, it's Dr. Brian McDonough, and welcome to the Dr. Brian McDonough Show. Those of you who know me or know of me know I do quite a bit of consulting, especially for companies that are looking at lifestyle and health issues. It's really important, obviously, that employees feel good about what they're doing, and companies look at it selfishly and they say, well, if my employees are happier, they're more productive. I mean, it makes sense for everybody. So when I talk to companies, I talk to them about key issues. But I'm bringing this up on the Dr. Brian McDonough Show because it's a concern to me. Burnout is becoming a major issue. Now, obviously, during the pandemic, it was heightened, and we thought it would go away, but it's not. It's a combination of many things. But rather than just take my word for it, there's a recent article in the Harvard Business Review which looked at it. And there has been a study from Microsoft which actually looked at employees across the board. And they found out certain things. For instance, managers, actually more than 50% of managers now say they are burned out. Now, we're not talking about just frontline workers who might be doing the jobs of two or three due to downsizing and cost cutting and pandemic issues. Now we're looking at managers in that situation. So what's going on and what can we do about it? Well, first of all, let's look at what the problem is. If you look at the Harvard Business Review, they look at things like unsustainable workloads as a problem. So a manager is trying to tell people to do things that they know is not sustainable. A perceived lack of control. Again, you're a manager, you're working, you feel you don't have control over anything. You have insufficient rewards for your effort. Your salary may have gone down, benefits may have changed, and yet you feel like you're doing more. There's a perceived lack of fairness, and it may exist in certain companies. Also, mismatched values and skills. And I think the biggest thing, a lack of a supportive community. You put all those things together, and it's a recipe for disaster. Now, companies are really good at saying we have burnout issues. As a physician, I can't tell you the number of studies I've read from the American Medical Associations or from hospital groups saying we must alleviate physician burnout. And yet, if you're a primary care doctor, and I don't have to tell primary care doctors this, or you as patients, they're being told to see more and more and more patients in less time to kind of keep the profits going. And then they feel as if they're not doing the best job for their patients, or they feel unfulfilled. You know, all of those issues, you could go across the board. So what do we do about it? I think the biggest thing right now is to admit we have a problem. And this has to go up to the senior leaders who may or may not be feeling the burnout. What they may be feeling is what stockholders and others are asking them about. But the reality is, if the workforce is not feeling good about themselves, it's bad for the company. And as a physician, if the workforce and anyone is not feeling good about themselves, I know it adds to stress. It adds to depression. It adds to anxiety. It adds to alcohol use, drug use, and misuse. It interacts, makes the family relationships bad. I mean, you get the idea. It's no reason why so many people are struggling and so angry. And what companies need to do is they need to pay attention to this. They need to look inward honestly and say, what are we doing for our employees? What are we doing for each other? And if that social connection isn't there, if that interaction is not something that is treasured, the company will not survive. And far more importantly, people could get sicker and sicker. And when I see studies like this and I see it continuing, we've got an issue and we can't hide from it. Thanks for listening.